The arm sling is indicated for fractures and other injuries of the upper extremity. There are different variants of the arm sling: standard blue, net, and kiddie. The standard blue sizes are extra small, small, medium, large, extra large. The net sizes are small, medium, large. The kiddies sizes are small, medium, large, extra large. In putting on the arm sling, fit the elbow snugly to the corner of the sling. Make sure that the sling covers the entire arm of the patient. Attach the Velcro strap to the side of the sling where the wrist is located. Run the strap over the opposite shoulder, across the back behind the nape, and over the shoulder of the affected side. Insert the strap into the buckle and secure it by reinserting it the other way to prevent slipping. Make sure that the foam padding is placed where pressure is greatest, which is the area between the shoulder of the affected extremity and the nape. The sling and swath is indicated for injuries of the upper extremity that need extra immobilization from forward movement of the shoulder. Examples are shoulder dislocations and post-operative procedures done on the shoulder. The sling and swath sizes are small, medium, and large. In putting on the sling and swath, fit the elbow snugly to the corner of the sling. Make sure that the sling covers the entire arm of the patient. Attach the Velcro strap to the side of the sling where the wrist is located. Run the strap over the opposite shoulder, across the back, behind the nape, and over the shoulder of the affected side. Insert the strap into the buckle and secure it by reinserting it the other way to prevent slipping. Make sure that the foam padding is placed where pressure is greatest, which is the area between the shoulder and the affected extremity of the nape. Insert the other strap on the buckle located on the elbow side. Pass the strap across the lower back and fasten it to the buckle located on the wrist side, thus preventing anterior movement of the shoulder. Indicated for shoulder injuries that need a 45-degree abduction immobilization, such as rotator cuff tear repairs and labrum repairs. Available in left and right. Place shoulder in a 45-degree angle and place sling underneath. Secure the straps onto the wrist, forearm, and upper arm of patient. Run the upper strap across the back and over the shoulder and insert it to the corresponding buckle. Run the lower strap across the lower back and insert it to the corresponding buckle. Indicated for clavicle or collarbone fractures. Clavicular splint sizes are infant, small, medium, and large. Position patient with both shoulders abducted to 90 degrees. Place clavicular splint in the middle of the back with padded straps over the shoulders. Run both straps over and under the shoulders, forming loops, and insert to corresponding buckles. Tighten both straps and secure by reinserting them into their buckles. Indicated for arthritis involving the wrist, injuries such as carpal tunnel syndrome, and other injuries. There are two variants, standard and kiddie. The standard sizes are small, medium, large, and extra large, and available in left and right. The kiddie sizes are small, medium, and large, available in left and right. Place the hand and wrist in a neutral position. The splint is designed so that it could be done by the patient himself. Insert hand into the splint. Insert thumb into the thumb hole and fasten the straps. Located on the volar surface of the splint are aluminum stays that are malleable and could be angled by the physician to his desired position. Indicated for finger and toe injuries, such as lacerations, abrasions, or post-op suturing. Comes in a roll with an applicator. Measure affected finger's length and cut the finger tube 2 to 4 times the length of the finger as desired. After dressing wound, place applicator on one side of the finger tube. Insert the finger into the applicator. Gather enough tubing to the base of the finger and pull applicator to the tip of the finger. Twist applicator 3 times and make a second pass to the finger. May be repeated to desired thickness. Apply surgical tape to the base of the finger. Indicated for injuries involving the lower extremity, such as the patellar dislocation and ligamentous injuries of the knee. Sizes available are 18 small, 18 medium, 18 large, 21 small, 21 medium, 21 large, and 23 extra large. Kiddie sizes are small, medium, and large. Make sure size is appropriate for patient. Align knee to the knee hole and make sure the medial and lateral aluminum support are on each side. If preferred, place foam padding behind the knee. Secure straps ensuring that the flaps overlap each other. If not, a bigger size is needed. Indicated for post-operative hip replacement surgery patients, restriction from midline adduction of the affected hip to prevent dislocation after surgery. In supine position, place the abduction pillow between the patient's legs. Secure all straps but apply loosely. Indicated for femoral fracture traction application pre-operation. Sizes include extra small, small, medium, and large. With the patient's skin on the leg and thigh exposed, place the skin traction splint against the skin tightly and fasten the straps. Place the weight spreader on the heel strap. With the patient's skin on the leg and thigh exposed, place the skin traction splint against the skin tightly and fasten the straps. Place the weight spreader on the heel strap. Tie a knot on the metal spreader and apply the weight pad. Place the weight spreader on the heel strap. Tie a knot on the metal spreader and apply the weight via sandbag or water bottle. Note that the physician must check the skin regularly to check for early signs of ischemia. The maximum application is for 2 weeks. Indicated for neck strains and other minimal neck injuries. Sizes are small, medium, and large. Make sure that the size of the collar is appropriate for the patient. The neck should not be hyperextended and the Velcro straps could be easily secured. With the patient seated and facing forward, align the chin notch of the collar to the patient's chin and fasten the Velcro straps behind the nape. Indicated for neck strains and other minimal neck injuries. Sizes are small, medium, and large. Designed to be adjusted to fit the patient perfectly. The upper and lower parts are detachable. With the patient seated and facing forward, align the chin notch of the collar to the patient's chin and fasten the Velcro straps behind the nape. Indicated for cervical fractures and to immobilize neck following vehicular accidents. Has tracheotomy hole for emergency tracheotomies. For emergency application, let patient remain in supine position. Apply the front part of the collar first and carefully insert back part, refraining from applying extra movement on the neck. Secure Velcro straps and transport patient via a rigid stretcher. Indicated for cervical fractures and to immobilize neck following vehicular accidents. For emergency application, let patient remain in supine position. Apply the front part of the collar first and carefully insert back part, refraining from applying extra movement on the neck. Secure Velcro straps and transport patient via a rigid stretcher. Indicated for cervical nerve root impingement and other injuries to the cervical spine that require traction. Set contains head halter, spreader bar, pulleys, rope, and sandbag. Take the head halter and place one pad under the chin and the other pad underneath the inion, which is the most prominent part of the occipital bone. Tie knots on the head halter threads and place on each side of spreader bar. Tie a knot on the middle of the spreader bar. With the pulley secured on the wall, place the rope on the pulley and tie the sandbag with weight, no more than 15 pounds for adults. Indicated for relief of sprains, strains, moderate disc conditions, muscle spasms, arthritic conditions, chronic unstable lumbar spine, and strains in sacroiliac area. Sizes are extra small, small, medium, large, extra large. With the patient in a standing position, place lumbar support against the patient's lower back, ensuring that the wider part is located below and the narrow part is above. Secure the two innermost elastic Velcro bands. Tighten the support by securing the two outermost straps. The belt is also designed for independent donning. Indicated for lumbar nerve root impingement and other injuries to the lumbar spine that require traction, like sciatica. Sizes included are 28, 30, 32, 34, 36, 38, 40, 42, and 44. Based on the patient's waistline, choose the appropriate size. On a plinth, place the belt and ask the patient to assume a supine position. With the belt positioned on the waist, fasten the strap securely. With the patient's hips and knees flexed, pull the lateral straps together. Tie a rope secured to a sandbag and apply weight not more than 1/3 of the patient's weight. Indicated for post-operative abdominal surgeries like cesarean sections and appendectomies. Sizes included are 8, 10, and 12. With the patient in supine position, place binder along the abdomen and covering the incision. Fasten the Velcro straps snugly. Indicated for various uses such as cast applications, securing of splints and gauzes, and compression of extremities. Sizes included are 2, 3, 4, and 6. For use in sprains and strains of extremities, ensure the tightness is not restrictive of blood flow. Indicated for various uses such as cast applications, securing of splints and gauzes, and compression of extremities. Sizes included are 2, 3, 4, and 6. For use in sprains and strains of the extremities, ensure the tightness is not restrictive of blood flow. Differs from standard elastic bandage in that it has Velcro for fastening. Indicated for various uses such as cast applications, securing of splints and gauzes, and compression of extremities. Sizes included are 2, 3, 4, and 6. For use in sprains and strains of the extremities, ensure the tightness is not restrictive of blood flow. Made of softer material, designed specifically for sensory impaired patients like diabetics. Indicated for quick application for sprains and strains. For use in sprains and strains of the extremities, ensure the tightness is not restrictive of blood flow. Indicated for use as initial wrapping for casting. Sizes included are 2 and 3. Indicated for use as a paddock for casting. Sizes included are 3, 4, and 5. Indicated for casting for fractures. Sizes included are 4 and 6. Indicated for casting for fractures. Sizes include 2, 3, 4, and 5. Colors include blue, sky blue, green, pink, yellow. Made of polyester and is more rigid and quicker drying than plaster of Paris. Material is lighter, thus is more comfortable for patients. When applying a full cast, stockinette is first applied, followed by a layer or two of wadding sheet. plaster of casting tape is dunked in water and applied to the area. Stockinette is pulled back and draped over for a cleaner look. Indicated for fractures that require splinting. Sizes include 2, 3, 4, and 5. Cut desired length of splint to cover affected limb. Drench in water or spray with water and apply the cushioned part against the skin. Secure with elastic bandage. Indicated for fractures that require splinting. Made up of malleable aluminum. Cut to desired length to cover affected limb. Fold to provide stability and secure with elastic bandage. For a more rigid splint, fold splint in the middle and fold each side forming a T-shape. Indicated for weakness or deformity of the foot and ankle, which requires stabilization for medical reasons and have the potential to benefit functionally. Sizes include small and medium. Available in left and right. Place heel snugly against the orthosis and fasten the strap. Indicated for ankle fractures and sprains. Sizes included are small and large. Place base of syrup under patient's heel. Sandwich leg between the two pillars and secure with straps. Using provided tubing, pump air inside each bladder to provide more support. Indicated for foot pain caused by injuries like plantar fasciitis. Place insole inside shoe to provide support. Indicated for heel pain. Place cup under heel when using shoes. Indicated for heel spurs. Remove silicone padding and place under heel to provide comfort. Indicated for patients with bunions. Insert ring on big toe and place shield on bunion. Provide effective support to maintain the realignment of the bone long enough for healing. Designed to reduce stress in the specific area for immobilization of the bones. To incorporate with a plaster cast for early ambulation on cast. Sizes included are small, medium, and large. Place under heel prior to casting and cast over fins, but leave rubber heel visible. Indicated for fractures and sprains of the finger. Indicated for fractures and sprains of the finger. Indicated for fractures and sprains of the finger.